Good afternoon, everyone. I see a few more people are trickling in. We do have a packed full house, so if people can just point out for those coming into the room, if there are extra chairs nearby them, that would be wonderful, and we've got some fantastic volunteers helping on that as well. My name's Nick Kerman. I'll be the moderator for today's session, and a little housekeeping today. We are in session HF5, Rapid Rehousing Strategies and Community Asset Mapping. You may be sitting there being like, yeah, I know, but I do know a guy in Halifax last year who sat through an hour wondering, when are they going to get to the presentation that I'm here to see? Wrong room. So I just want to make sure everyone's in the right room for this, and hopefully you are. As we kind of process what was a really powerful keynote and really powerful residential school survivor voices that were integrated in that, and the emotionality that comes from that, I think it's also important that we continue to think through some of those key messages throughout the day and acknowledge where we are today. And so I just want to read aloud the acknowledgement, the land acknowledgement for the conference and where we are currently located. So this year's conference is being held on the traditional unceded territory of the Anishinaabe Algonquin peoples. The peoples of the Anishinaabe Algonquin Nation have lived on this territory since time immemorial. Their culture and presence have nurtured and continue to nurture this land. We acknowledge and celebrate the many First Nations, Métis, and Inuit peoples from coast to coast who participate in the conference and lead the work to end homelessness on Turtle Island. Today's session is going to feature 3 presentations from folks working in the Ottawa area. And I'm delighted to turn it over first to Madison McCulloch, who's with the Alliance to End Homelessness Ottawa, and Raynor Boutet, who's with the City of Toronto, who will be sharing City of Ottawa. Thank you for that. I knew there was going to be one major error, and that was it. Who's going to be sharing their work on rapid rehousing. So please give them a warm welcome.
Can everybody hear me okay? Yeah? Okay, perfect. So good afternoon, and welcome to the presentation, Rapid Rehousing with an Enhanced Subsidy. My name is Madison McCulloch, and I'm here on behalf of the Alliance to End Homelessness Ottawa. The Alliance to End Homelessness Ottawa is a member-driven coalition of people and organizations who are working together to prevent, reduce, and eliminate homelessness through systems planning and coordination, public education and advocacy, and mobilization. The Alliance Ottawa currently represents more than 75 local community-serving organizations. We're pleased to talk to you today about a rapid rehousing pilot that was conducted in some of Ottawa's physical distancing overflow centers. I'm just going to refer to them as PDCs because it's a mouthful. In this pilot, we utilize a collaborative approach between city and community services. We sped up the housing process by offering on-site wraparound supports, and we improved housing outcomes for PDC clients by using an enhanced shelter allowance that matched our city's median rent. So I'll pass it over to my co-presenter, Raynor, who can introduce herself and give a bit of background on the project.
Hey, thank you. So as Madison said, I am Raynor Boutet. I am with the City of Ottawa. I'm part of the Housing and Homelessness branch and collaborative planning and projects. You can't hear me? We're good? Yes? Okay. I could just yell and use my mom's voice, but with the mic in front of me, that might not be good. So a little bit of a background. So as Madison said, this project was a pilot, a prototype project that was put together to address the increase of people that were at our physical distancing centers with the core deliverable of trying to get them out of the physical distancing centers and give them back to the community. Oh my God. Good thing I'm prepared and have my notes in front of me, huh? I've done this 1,000 times. So there was obviously the increase of demand in our shelter services. This was originally done during COVID to have the safe distancing for individuals in the sheltering system. But as we got out of COVID, we did still have that need for the sheltering space, and our physical distancing centers became physical distancing emergency overflow shelters to address that need. We were facing an affordable housing affordability crisis with insufficient rent supplements, and we needed to address that as well as the capacity in our shelter system. So with the support of our housing and homelessness leadership table, the support of the Alliance and the city, we all collaborated together to put together this rapid rehousing prototype. So the objective of this prototype, as I mentioned, was to rapidly rehouse single individuals who are using our physical distancing overflow centers. The deliverable at the time when this project was conceptualized, there was 120 individuals living in the PDCs. So we had a budget in mind to house 120 individuals to get our PDCs back into the communities. But the part of this was not just to be able to provide them with the enhanced benefit that Madison referred to, but also to provide them with wraparound supports on site. So we weren't just giving them one piece of the toolbox that they needed to find housing, we were giving them all of the wraparound supports. We leveraged and utilized multiple partnerships across the city. So City of Ottawa supports and services we have in-house with partners of the Alliance, as well as community partners that came to the table to help provide these supports to the individuals in the PDCs. And we were going to be doing this. The enhanced benefit amount was done in line with what we were seeing as average market rents. So we were able to open up that window for clients looking for housing a little bit wider, was when the existing benefits was a lot lower and the availability was a lot smaller. So we were using this as a pilot to get those individuals housed. I think it's going to hand it over to Madison to talk a little bit more specifics.
So like Raynor had mentioned, an important feature of the Rapid Rehousing project was the fact that the clients had access to on-site wraparound supports, and these supports were integral to their ability to access housing. Like I mentioned, the services were on-site, so that eliminated some barriers that people will sometimes experience when they're trying to access support services, like having to make an appointment to see somebody or having to travel, to a different place in the city to get to their appointment. Also, a second unique feature was the fact that the clients in the PDCs were allowed to stay in the centers during the daytime. And this is different from other shelters in Ottawa where folks do have to leave during the day. So since folks were able to stay during the daytime, it gave them even better access to those on-site supports. In terms of housing supports, there were 8 housing caseworkers that were working between the 3 physical distancing centers. Of course, they help clients with finding, securing, and settling into housing. Different work that could look like could be getting the right documentation in order to be eligible for subsidized housing, doing landlord recruitment, setting up viewings, move-in supports, et cetera. So a housing worker could work with up to 25 clients at a time. And we will see that that's quite high compared to other teams, like a housing first team where you might work with like 12, 15 clients. And that is because the clients who were in the physical distancing centers were generally lower acuity. And then also the fact that there were other on-site supports meant that the caseworkers didn't have to provide as intensive services. So they were able to work with more people at one time. For a period of the pilot, we also had 2 rent supplement agents working directly in the PDCs, and they were there to process rent supplement applications. That made for easy communications between the rent supplement team and the housing worker team. So whenever there was a rent supplement application that was sent in, if there was any missing information or documentation, they could work that out between themselves pretty easily. The clients also had access to settlement supports thanks to weekly visits to the PDCs made by Matthew House Ottawa, who's a local agency that offers transitional housing and settlement assistance to refugee claimants. The Matthew House Ottawa outreach worker met with 140 clients during a 3-month period, and they offered 125 settlement supports. So what that could look like is help applying for the work permit, help communicating with legal aid or IRCC. And all of these supports that they would have received does contribute and supported the housing process because it helped clients get those things done that you kind of need to be able to be eligible for a rent subsidy, like getting your refugee, getting the refugee claim submitted, getting access to income, maybe being connected with work. And finally, clients also had access to financial and social assistance through regular visits by the city's Outreach and Mobile Services team, OMST. So they offer supports to helping clients connect with their Ontario Works, their social welfare worker. They did internal referrals to other social programs, and they also issued social assistance housing benefits. So during the 3-month period, the OMST provided over 300 services, and the top service being the issuance of those housing benefits. And what was nice about having the OMST on site is that they also, were a source where clients can go to get that support, to get that documentation ready to be eligible for subsidized housing. So they didn't only have to rely on those 8 housing workers. There was other places where they can get that support. With the on-site supports, we knew that we would be able to get clients document ready for housing, eligible for subsidized housing pretty quickly. But I think we know that you can only go so far with getting people ready for housing if there's no actual housing opportunities. So that's why a big focus for the housing team was developing new and maintaining existing relationships with nonprofit housing providers and private market landlords. Housing workers, I should say first, because a majority of the clients in the PDCs were refugees, mainly refugee claimants at 69%, a priority at the onset of the project was to reestablish a working relationship with Matthew House Ottawa, as they are also Ottawa's largest transitional housing provider for refugee claimants. So what Matthew House started doing when they were doing those weekly visits to provide settlement supports, they were also doing eligibility intakes with the shelter clients to see if there was anyone who was eligible and interested in being diverted from shelter to transitional housing. And if they did move on to the Matthew House transitional housing, there they could continue accessing settlement supports as well as support with getting into permanent housing. We did note that Matthew House had the most success with clients who were the newest entrants into the shelter system. So knowing that the PDC staff works in collaboration with the Matthew House staff to identify the newest entrants in the PDCs and say, hey, these are the people that you should be doing your intakes with. So that was mostly people who were in those overflow beds. During the pilot period, there were 62 eligibility questionnaires completed, which led to 20 people moving from being diverted from PDCs to transitional housing. The housing team also maintained relationships with permanent social housing providers, which accounted for 57 clients moving from PDCs to social housing. If we break that down, it's 42 going into community housing and 15 going into supportive housing. And then, as you can see from the numbers here, the private market really created the most opportunity for outflow from the PDCs. So the housing team worked pretty diligently to recruit landlords to, lease to our clients. So there were a total of 30 landlords that worked with the housing team and the rent supplement team during the pilot period, and 14, so about 50% of those landlords were actually new landlords that were joining the rent supplement team. That's in part thanks to the hustle of the housing team, but also it's in part thanks to the enhanced allowance, which I'll get to in a moment. But first, I just want to mention that there were a total 192 clients that were housed into the private market during the pilot period. So the enhanced housing allowance, in order to scale up the housing outcomes from the PDCs, we did pilot an enhanced housing allowance that removed barriers to housing for project clients. Beyond being an income-based transportable rent subsidy that's paid directly to landlords, there were a couple unique features of the subsidy. The most unique feature would be the maximum allowable rent. So it had a maximum allowable rent of $1,800 a month. And this matched Ottawa's private market rates as it was determined based off of the calculation of Ottawa's median rent at the time. This differed from other federally and provincially funded subsidies. For example, if we look at Ottawa, a lot of folks access the COB, the Canada-Ontario Housing Benefit. And for us, the COB, the maximum allowable rent is determined by CMHC's average market rent of your city. So I think for Ottawa, it was like $1,347. So when we're jumping from $1,300 a month to $1,800 a month, that's a pretty big jump. Also, since the subsidy was funded and managed at the municipal level, we could play around with the eligibility criteria a little bit more. So one thing that we did to remove some barriers is that folks were able to apply for a rent subsidy before they had received their social insurance number. And that was done because a lot of the clients in the PDCs were refugee claimants, and they had applied for their SIN, but they were kind of just waiting till they'd received the SIN to be able to start looking for housing. So whenever an asylum seeker wanted to apply for the subsidy, they could. They just had to provide proof that they've applied for their SIN. As Raynor mentioned, the enhanced benefit was utilized with single adult shelter users. It was geared towards people who are document ready for housing. That way, it's people who can take advantage of housing opportunities as they're coming up. And then also geared towards folks who are considered to be low acuity. Because the housing workers had such high caseloads and the point of the project was to house people rapidly, there was limited capacity to provide intensive supports after move-in. Within the pilot period and within our budget, there was 161 individuals housed with the use of the enhanced allowance. So we were able to exceed our target by 34%. Reflecting the populations in the physical distancing centers, the majority of the recipients of the benefits were refugees at 81%. If we look at the average rent of the subsidy users, so while the maximum allowable rent was $1,800 a month, the average rent of the subsidy recipients was around $1,640 a month, with an average benefit allocation of $1,240. So if we look at the average benefit paid, it came out to be about $380 higher than what, for example, someone would get through the COB. So that's a 44% increase.
So although this project had a lot of incredible things that came out of it, of course, there were some unintended consequences, and I get the lovely job of sharing them with you. So obviously the picture of what the situation in the physical distancing center was when we started versus when we actually got into it changed dramatically. Not only did we not get out of PDCs during the course of this implementation, we actually opened a third PDC to account for the influx of new refugee claimants coming to the city. So that was obviously something that we did not plan for. But because of that, it led to some of these additional unintended consequences. So we did see, as Madison mentioned, we increased our sort of database of landlords that were supporting the rent supplement program from the original 16 up to 30. And a lot of them was as a result of that increased benefit. So we did see the effect of landlords going, perfect, now I can raise my rents because they're doing increased subsidies. So this was an unintended consequence, but our housing caseworkers, to Madison's point, had worked diligently with these landlords, explained the situation, went over in details, caught some of these when they were starting to see these trends going. So they were able to sort of address that unintended consequence. But in light, we did see some of the rents going up. I do want to add that these landlords that all joined during this pilot project are still part of our rent supplement program. We have not lost any of them. We just may not have as many units available, but they are still part of the program. We did see a negative impact on other housing teams. Our original onset was to be able to provide more flow within the shelter system with these benefits by getting people out of the physical distancing centers into housing and perhaps moving people around the system a little bit more effectively. But unfortunately, we did not see that because of the increase in demand. As in such, this increased benefit then affected housing caseworkers in other areas and other community partners because they did not have access to this added benefit. So their clients weren't being able to find locations to move into as quickly as ours were. The final one is we did hear, and this is anecdotal, we don't have any stats to go along with it, but there were a few situations we were hearing that people were fighting to get into the PDCs. They were not wanting to go anywhere else. They just wanted to get into the PDCs only to access this benefit. We've heard stories of individuals who would leave units that they were currently in to get into the PDCs to get access to this benefit. But thankfully, a lot of the collaboration and the work that we did with all of our partners, with the different departments with the city. When we would see or hear someone talking about doing this, we would talk with them, work with them, see what other supports we could perhaps provide them so that they wouldn't leave, especially if they did have a house or a place that they were staying that was safe for them to stay in. We didn't want them leaving just because they thought there was a potential for a better benefit. So we did have a lot of that collaborative effort to make sure that these unintended consequences were as minimal effect on the project as possible. Do I have the next slide?
I think I do.
I think you have the next slide.
I'll just go over the main outcomes of the project. So by providing a housing allowance that matched the city's median rent, we did see significant increase in housing options in the private market open up to our clients. So by using a scraping tool, we were able to collect basically all of the listings from multiple housing rental websites in Ottawa, which would give us like a list of, all the existing unit listings in Ottawa in real time. Sorry, I hope that came out okay. If you want to ask more questions about what that means, I can talk about it later. But basically, we could see, we have all the listings in Ottawa that are available right now. If we look at the folks who would access the COB, for example, and we looked at the listings that were available, we can see within the budget of the COB, that subsidy recipient would be able to afford or access about 16 units. On any given day, it was an average of 16 units that they could get to. However, when we look at someone who had access to the enhanced benefit, they would be able to access 277 units on average on any given day. So we can see that's a pretty big increase. That's a 1,600% increase in unit listings that are now accessible with an enhanced benefit. We could also see the increase in housing options becoming available, again, by the number of new landlords who are joining the rent supplement program. So like I mentioned, it was 14 new landlords. And of course, whenever you're increasing the budget, you can now access landlords whose units were previously out of reach. So that definitely helped in the project. And yep, I'll go on to the next one. So outcome, decreased time in shelter. A significant outcome was our ability to speed up the housing process from the moment someone entered shelter to the point where they were approved for a subsidy and they were signing a lease. So once someone enters a PDC, it can take maybe a couple weeks before they're able to meet with a housing worker. I think in an ideal world, they would be meeting with a housing worker within a couple of days, but I think we know that, with the caseloads, that's often not possible. That being said, since we did have other supports on site, like Matthew House Ottawa, like the OMST, people didn't, have to wait till they met with a housing worker to start getting that documentation in order. They could start being connected with income supports. They can start getting their IDs ready. Another unique feature of having Matthew House Ottawa on site was the fact that knowing that we had, specialized knowledge about the refugee claim process and about immigration processes on site, it meant that no one was really falling through the cracks, which can happen when you're kind of in a regular shelter that doesn't have that specialized knowledge. What may happen sometimes is someone who intends to make the refugee claim, if something goes wrong in that process and they don't have the right support to see it through, they kind of just fall in limbo and they remain in shelter without status. Having access to the enhanced benefit also sped up the housing process. Of course, those clients could find units within their budget more easily. So if we think back to those 16 units that, someone on the COB could access, that means that all housing teams, all people in shelter who are trying to access housing are all vying for those same 16 units. So of course, when we expand the budget and we have 277 units that are, potentially accessible, we can see that there are enough units available to meet the demand. So that's why our clients were finding housing much more quickly. Finally, as I mentioned, since the enhanced benefit was funded and managed at the municipal level, so it's all managed within the city's rent supplement program, where we had 2 dedicated agents to process those applications. And that really allowed us to do true rapid rehousing. After an enhanced allowance application was submitted, that person the application would be processed and they would be approved for the subsidy within 2 days. So if we compare that to the COB, for example, after someone submits that application, it can be up to 8 weeks before they hear back from the ministry and they're approved for the subsidy. And during those 8 weeks, that person is kind of just stuck in shelter waiting to become eligible for the subsidy to start looking for housing. So when you're going from 8 weeks to 2 days, now we're talking rapid rehousing. Unfortunately, because of the nature of the pilot, we weren't able to calculate a decreased time in shelter necessarily because the pilot was in a pretty tight, it was a short time period. That being said, we know before the pilot, the housing workers could house maybe, 10 people a month. And then after the pilot ended, the housing team was kind of going back to housing about 10 people a month. However, during the pilot period, you can see 30 to 40 people being housed in a month. So that's, a 300% increase. Lastly, I just wanted to talk about a 6-month post-intervention survey that we did with subsidy recipients. We did have a low response rate. It was a 30% response rate. Regardless, the responses that we did receive did provide some interesting insights. So 100% of respondents remained housed 6 months after leaving the PDC. 14% of them, so I think it was around 7 people, remained housed, but they were in a different unit. And the reasons for having switched unit varied. I think a couple people said that they felt the unit was too expensive or unsafe, or there were some unspecified reasons. There was 69% of respondents identified that they were satisfied with their housing. So aspects of their housing that folks were most satisfied with was feeling safe and secure. They're happy with the conditions of the housing, feeling like they had enough space. One interesting observation that was made by the housing team when we had initially introduced the enhanced allowance was that, in speaking to their clients, they felt that with this deeper rent subsidy, clients could now access units that they perceived as being safer. And that could be perhaps because of the location of the building that the unit was in, or maybe because that building had generally better upkeep. So people were feeling safer with their options. And I just find it interesting because when we look at the satisfaction, I think that some of that, those assumptions are reflected in the survey responses. An aspect of housing that folks were least satisfied with was the affordability. Of course, whenever we have a deeper rent subsidy, people can access more expensive units, which I think we can assume to mean people are going to be relying on that subsidy for a bit longer period of time. So I understand why some people may feel like their unit was not affordable to them. So we'll just finish up by talking about some key takeaways. Due to the nature of the pilot, the project and notably the enhanced allowance wasn't necessarily sustainable being funded on a municipal level. That being said, running such a pilot did provide us with some really interesting takeaways. The first one being the importance of collaboration between community partners to increase outflow from shelters or PDCs. So having a housing partner do intakes on site highlighted the potential for close collaboration between shelter staff and housing providers, especially when we looked at Matthew House. Whenever, you can just be in shelter one day and you can literally point out the people who are the priorities rather than putting someone on a list and trying to get a hold of them at a later date. Prior to the pilot, communication had broken down between the PDCs and Matthew House Ottawa, and we weren't really seeing a lot of referrals being made. However, once Matthew House started doing those weekly visits, you can expect to see people leaving into transitional shelter on a weekly basis. With the shelter outflow being as high as it was, we were left with another lesson. While increasing opportunities for outflow is essential, it's equally as important to implement approaches to try and reduce inflow into shelter. That could be, implementing shelter diversion or implementing prevention strategies. We did see an incredible amount of people be housed in a 4-month period. So we saw a little over 270 people being housed. That being said, as soon as someone was housed and a shelter bed opened up, there was someone that was ready to come in and take that spot. Our ability to decrease the processing time for rental subsidies really demonstrated how much policies and processes can contribute to delaying the housing process. Conversely, whenever you have policies and processes that are thoughtfully developed and adaptable enough to meet emerging needs, we have the potential to unlock our ability to rapidly rehouse. So by changing the way we process subsidy applications and properly resourcing our rent supplement team, we were able to decrease the subsidy processing time, as I mentioned, from 8 weeks to 2 days. So it's a 96% reduction rate. We need to work with our different levels of government to identify solutions that address these processing times for the subsidies. Processes are created by us and they can certainly be changed by us.
And I'm just going to quickly wrap us up with the last takeaway, ties into the policy change and procedures at the rent supplement level, but that we really do as a community need to advocate to get them to look at the market rents and the level of the rent subsidies, because clearly the rent subsidies that are out there are not reflective of the market rates. And as a result, we have the crisis that we're in, and we have 16 beds that fall within the rent supplement for way more than 16 people. So this is really what the key takeaway of this initiative was, that there needs to be more advocacy at that level, but that this collaboration and these wraparound supports and bringing the services and the supports that all of our clients need in order to be successfully housed, we need to bring it to them so that when there is an issue or if there is something that a wait time, we don't need to have them sitting in the wings for 2 weeks. Like Madison mentioned, if they're waiting on A, well, they can take care of B, C, and D while they're waiting, so that when it all happens, everything is all done. So those are the key takeaways from this project. It was a very successful project. I want to thank Madison and the Alliance for supporting this project with the City of Ottawa as well. And I'm going to put our contacts up on the screen if anyone has any other questions. We'll do questions at the end. I should have said that. Sorry, I confused.
No worries. We'll do questions at the end. Thank you for that wonderful presentation, Madison and Raynor. I'd love to invite up to the stage Dr. Maryann Roebuck and Stephanie Manoni-Millar of the University of Ottawa, who will be sharing, if I can find it, here we are, their evaluation work on rapid rehousing for refugees.
Thanks, Nick. Thanks to the previous presenters, we have some really nice synergy between the two presentations, so that's really fun. While Stephanie and I are presenting as study researchers, I also want to acknowledge Tim Aubry and Khadija Quds Akbar, who were also study researchers for this project. And we're also kind of representing the organization that we conducted this evaluation for. We had a really nice advisory committee involved in this evaluation that included OMRA representatives, as well as 2 subsidy recipients and an external community partner. Okay, I've got a lot of paper here. I probably shouldn't have done it that way, but so by resettled refugees, we're not talking about refugee claimants, but resettled refugees also face a lot of challenges related to housing stability. So resettled refugees are people who come to Canada already with permanent residency status because they're government-assisted refugees or privately sponsored refugees, or blended visa office referred refugees, which are a combination of government-assisted and privately sponsored. So we know that refugees, including those with permanent residency status when they arrive, are highly affected by the current housing crisis. The crisis is driven, as we know, by a lack of affordable housing, low rental stock, and increased housing demand. Refugees' experiences are compounded by housing discrimination, language challenges, trauma, and a lack of access to education, training, and employment. With resettled refugees, they are supported with our refugee support system for the first 12 months when they arrive. Even that first 12 months, they're not fully supported financially in a way that they need. But there's a 13th month that represents a lot of stress and strain for resettled refugees because there's this expectation or assumption built into the system that it will take 12 magical months for a refugee to become financially independent in Canada. This isn't possible, and it doesn't happen so often. In that 13th month, the financial assistance is removed and people need to move. Sometimes they end up in shelter. They've taken time to settle in a neighborhood, and often they have to move sometimes to a different neighborhood, sometimes to a different city. So there's a lot of strain in that 13th month, which is the time period that the program that we're speaking about targeted. So OMRA is not an acronym, it's how the organization and program are referred to. OMRA began their provision of portable rent subsidies in 2017. They're very grassroots, volunteer run. This was a group of about 5 women in Ottawa who saw a need in a number of resettled refugee families. They decided prior to 2017 to pull together the community that they had around them and fundraise through selling grocery cards. It's a very interesting fundraising mechanism that they've used. So they pulled together and fundraised, and with their initial fundraising efforts, they bought townhouses to house about 4 resettled refugee families. And then after a couple of years, they decided they could reach more people and use the funds in a more creative way by providing a top-up rent subsidy to families who were already in the private market, but just were facing financial strain. They weren't able to fully cover their rent. So they provided rent subsidies. Some of them received the rent subsidies before they hit the 13th month, and some of them afterwards. They're referred by settlement agencies or by private sponsors. So the referrers are highlighting this challenge in paying rent. And then just like on a case-by-case basis, the organization calculates the gap, the top-up that's needed for the families in order for them to stay stably housed. So the organization provides portable, time-limited rent subsidies to resettled refugee households. And then just because of the strain in the settlement system, they also have tailored their programs to provide individualized support like English tutoring, housing help, system navigation, and orientation. This is my pitch for evaluation, so don't read too much into the logic model. But in addition to partnering with this organization and being able to answer their evaluation questions, one of the big values of this evaluation was to work with the organization to really articulate the program that they're providing. Again, it's volunteer run, really grassroots. So we were able to talk through the theory of change for the program, develop a logic model, which is now a tool that they can use moving forward. And then we were also able to articulate what they were doing in light of the evidence base. So we were able to locate the program within the rapid rehousing literature, which also equips them to be able to advocate and to define their program in an effective way to sustain them in the future. As researchers at the University of Ottawa, we conducted this evaluation to determine facilitators and barriers to program implementation, to provide a financial analysis of the program, which I'm not going to go into too much in this presentation, to evaluate the client outcomes of the program. The organization identified the outcomes as housing stability and as well as educational and employment outcomes that they were interested in, and to provide program recommendations. But in this presentation, I'm going to speak to recommendations a little bit broadly beyond the recommendations we gave to the program. So what we did was we used a mixed methods sequential design. So the data collection methods then informed the initial data collection methods, then informed the subsequent data collection methods. So we reviewed the admin data for the 81 recipients of the top-up subsidy. Based on that analysis, we developed our key informant protocol. Based on the analysis and the results of the key informant interviews, we then used the results to develop our client survey, which then informed our client interviews. So these were mixed methods, quantitative and qualitative data collection methods. Our client survey was really successful. We were really happy with it. We had a high response rate. And one of the big facilitators of this high response rate was we translated the survey into all of the different combinations of languages that OMRA identified. So we had 6 languages, but the surveys were like an English-French combination, an Arabic-French combination. Like it was really nice to work with OMRA in this way and challenging to navigate all the translations as well. But the client interviews also we conducted in 4 languages. So here are the study findings. First of all, I won't go into the characteristics of the program recipients very much, but from 2017 to 2023, 81 refugee households were provided with portable rent subsidies. They tended to be, the organization provides the rent subsidies based on how long the families need them for. So every six months, they're meeting with the families and talking through their financial situation. Every 6 months, the subsidy might increase or it might decrease, or they might begin a transition to end the subsidy. So usually this was a 2-year long period, sometimes more and sometimes less. Also, about 80% of the 80% of the recipients were families. So a family unit with more than one person, and then 20% were single individuals. And then this chart, it really just actually illustrates the fundraising efforts of this grassroots organization. So every year, the fundraising, the organization has been able to raise more funds. We didn't have the full 2023 numbers, so it looks like there's a dip there, but I think it's higher than that. So this organization has done really well, and they're ready to grow. And then on this slide, I'll just say that the average monthly top-up subsidy tends to be about $250 to $500 a month. And again, it's very individualized. So sometimes it's been as much as $1,000, sometimes as low as $50 a month. So you can get a sense of what that amount is. I'll turn it over to Stephanie now. Whoa.
So next I'm going to talk about the facilitators and barriers to the program implementation. And in terms of implementation facilitators, there was both individual level and program level facilitators. So on an individual level side, there was the individualized practical support subsidies. There was tutoring, so that was English tutoring, and settlement support. There was increase and gradual decreases of subsidy with a transition period. So they were very gradual on when they were adapting their subsidies. There's also one example that came from an interview where an individual had stopped receiving subsidies, but they were still in contact with OMRA. And when they went and did a surgery and had to take off work, OMRA went back and gave them subsidies again. So it was very personalized support. And it was also connections with refugees with similar experiences. So OMRA would host barbecues, events in the park to really build a community of the refugees that they were supporting. A lot of the refugees that we interviewed talked about how OMRA was a key support in their transition to their life in Canada. On the program level, there was the OMRA subsidy agreement. So just having a written agreement of what was included in the subsidy and what was expected from the agency as well as from the recipient, such as the expectation that they were going to be doing language training and looking for employment in order to get on their feet independently. There was also a furniture startup partnership. So there was partnered with an agency in Ottawa in order to furnish their homes as they got them with free donations. And there was flexibility, innovation of the program, and a lack of bureaucracy. So it wasn't as much as paper filling out as it was a conversation between the OMRA representative, which they call an OMRA Sherpa, and the individual receiving the rent subsidy. There was also community building, such as grocery cards and annual park gatherings, as I mentioned. The implementation challenges for the individual level, a lot were based on the language barrier and finding work. So it was a difficulty in finding the practical proceedings, finding a career, coming to Canada where some of their background experience was not necessarily recognized, so helping them support to get to the level that they were at. There was intersectional challenges, so women faced additional challenges in accessing education while in Canada. Higher subsidies were needed for some participants than others, as Maryann mentioned. And as the program continued, there was more and more refugees that were seeking access to OMRA services and their rent subsidies. So sometimes clients were kind of confused of what OMRA does because they did such a large variation of support. They supported them with community building, they supported them with rent subsidies, they supported them with furnishing, etc. And so the key message of what OMRA does was not necessarily something that transpired to the client. And implementation challenges on the program and system level were the financial stress and insufficient government allowance for newcomers. So I have a quote here at the bottom: "The assistance of government provided barely covered our rent. We had nothing else. The assistance government provided was feasible for refugees in the past, like 15 years ago, not now." So really the discussion of the government-assisted programs for refugees was not supporting what needed to be helped, and OMRA was able to top up and support the additional part. Another challenge that OMRA faced was that it needed to be better known in the community. So OMRA is not very known in the community of Ottawa. I see some head shakes in the room from people in Ottawa who've maybe never heard of OMRA. They also have a lack of funding. They receive a lot of their funding by fundraisers within their community. There's a lack of written concrete policies and procedures, and there's also a burnout in the individuals. So as Maryann mentioned, the program is extremely grassroots. It's run by 5 women who are taking this on and realize that it might not be sustainable if it's only the 5 of them running this program independently doing fundraising. So settlement agencies are overworked and cannot provide enough supports and information. So it's clear that there is a gap in the resources that are needed to be changed. And next, to what extent program clients experienced improved housing outcomes while in the program? So we conducted the SAMHSA Housing Satisfaction Survey, so the Substance Abuse Mental Health Association Housing Satisfaction Scale, and we did a comparison of means from each individual across to all of the other items. So for example, being close to shopping against all of the items on the list to see the comparison there. So overall, survey respondents were very satisfied with their housing. The mean satisfaction ratings were significantly higher for living close to shopping, close to public transportation, and close to services, and also having control over who cannot come into their home. So it helped them be satisfied in their life since coming to Ottawa. And then the satisfactions were lower for areas such as having control over the choice of their housing, condition of their home, and affordability. So while OMRA did support some individuals in finding their housing, it wasn't a condition that OMRA had, and most of the refugees that we interviewed and surveyed were already housed before they started receiving OMRA. So most OMRA clients are housed in private market rentals and stay in private market rentals after their subsidies. So 80% of respondents' current housing status were in private market housing, where in the past recipients, 90% were still receiving private market housing. Overall, clients stayed in their housing for a long period of time, and there was a low number of moves. So 46% of the participants who responded to our survey indicated that they had moved 0 times since arriving in Ottawa. The most that had moved was one individual who moved 4 times, but no one had moved more than 4 times, showing that there is a stability in the housing that they are receiving and the support of the rent subsidy. Next, to what extent have program clients experienced improved educational outcomes while in the program? So 80% of survey respondents had attended a school program since they began joining OMRA. This included language schools, credential recognition, high school completion, and college and university degrees. You'll see in the lighter green that it's also, we accounted for the spouses' experience to education as well, although we do not have a concrete number of how many spouses there were in the survey. So majority of individuals did complete some schooling, and as I mentioned, they all did complete language training with a tutor. And then the next with employment. So majority of participants were employed were unemployed before receiving OMRA. And after receiving OMRA, there was a higher number of people who are employed in multiple capacities. So these numbers, if you count them up really quickly in your head, you'll see that they don't add up, but that's because individuals were talking about, they would have a volunteer position as well as a part-time position, a full-time and a casual employment. There was a mix of employment there. So 52% of respondents did start working since they received OMRA, and 8 of the spouses did start working. And to what extent have clients improved quality of life outcomes while in the program? So this is talking about psychological well-being, social support, reduced loneliness, community integration, and social connections. And it was primarily collected through interview data. So 6 of the 11 clients that were interviewed had positive social and psychological support, impact on their lives. And there was a guidance towards helping in their daily Canadian life. Clients really talked about having the OMRA representative help them guide finding employment, finding a social circle, and finding a network of people that they could connect with. And they did talk a lot about feeling a lot less lonely. So the OMRA organization was able to provide them a support where they didn't feel as lonely when they came to Canada as when they came to Canada. And here are some quotes. So I'll just leave it on the screen for a second if anyone wanted to read them or take a picture. And then, in what ways do participants attribute improvements in their areas of their lives since the rent subsidies? So the link between outcomes and OMRA, there was 10 client interviews who had a clear link that OMRA did change their life. And that the programming did support the improvement of their education and employment. A lot of individuals talked about how what OMRA did was provide them time to learn, time to stay with their family, time to practice a new language, and just time overall to be able to settle themselves in Canada. So next, I'm going to pass to Maryann for the conclusions.
So overall, this program has successfully provided refugee households with additional financial support so that they can remain stably housed where they're already at. Like I said earlier, we were able to locate the program within the literature. So when we did a literature search, we couldn't find any research on housing first with refugee households or rapid rehousing with refugee households. And there seems to be a disconnect between the housing literature and the settlement literature. So the program aligns well with rapid rehousing. It helps people to stay in permanent long-term scattered site housing units through portable rent subsidies. They also provide support, or the support is provided through settlement services, and it's a population where it seems to make sense for the subsidy to be time limited. So that's something that's communicated to the recipients from the very beginning and is messaged, and there's a closure process to it. This is a quote from a partner who was almost showing that gap in thinking, like this is a program that's speaking in the housing affordability space, but they need to understand where they sit in the housing affordability space. Oh, I didn't even show that slide, sorry. Okay, so those are in the slides that we provide through the conference. So finally, just some broad recommendations, which are quite intuitive. So we recommended to the program to formalize and articulate their individualized support. So it was better defined, to continue with the individualized assessment for the subsidy amounts and the reassessment. They're looking at expanding the funding model. So we highlighted the areas that the partners and the recipients were telling us needed to be expanded. And one of the things that they're moving forward with that they were already working on was linking with a larger, more sustainable organization to bring in that additional capacity. And we think that rapid rehousing for refugee households is a worthwhile model to look into and to explore in terms of replicating. And then, of course, this top-up wouldn't be necessary if the Government of Canada increased settlement access to resettled refugees. So that's another big recommendation that's come out of this project. Thanks, everyone.
Thank you so much, Maryann and Stephanie. Quite striking parallels between those two presentations with regards to housing outcomes, housing satisfaction, both on some of the components where refugee recipients are scoring higher and lower. Very striking. Thank you so much. Our last presentation today, I'd like to welcome up Ashley Bryan and Stephen Sauppe from Options Housing, who will be sharing a little bit with us about their community asset mapping work.
Over to you guys.
Hello, everyone. Wow, we're quite a room. So I just wanted to start our presentation with a land acknowledgement. So Options Housing acknowledges that the land upon which we live and work is the traditional, unceded, unsurrendered territory of the Algonquin Anishinaabe Nation. For generations, this land has been governed and inhabited by Indigenous peoples practicing traditional ways of doing, knowing, and being. We are grateful to have the opportunity to be present on this territory. Thank you. So good afternoon, my name is Ashley Bryan and I'm a Housing First practitioner with Options Housing. And I'll be presenting alongside my colleague, Stephen Sauppe, as he is our peer support on our Housing First team. So I'd like us all to take a second and think about where you live and how it makes you feel. Now imagine next week you're moving into a new apartment in a new area of the city. I'm sure you feel a mix of emotions, but primarily that of maybe excitement, elation, maybe a smidge of anxiety. You're feeling excited to have your own place after living with roommates for many years, but you'll also have to navigate an entirely new area of the city, far removed from the area you have grown to know and familiarize yourself with. Today is the big day. You are moving. You can't wait to explore your new neighborhood, to see what you can find and the new people you will meet, but you feel a bit unsure as to where to start. Now imagine this scenario without access to the internet in your new home. I'm sure you're thinking, no biggie, I can use my phone. I've got lots of data. Now imagine not having a phone. Imagine not having friends or even family to connect with and not knowing any of your neighbors. This is often the situation many of our clients face. The excitement of finally moving into their own home with the fear of complete isolation. This is why community asset mapping is so impactful to clients. It allows them to see that there are places close to their home and their community that are accessible, such as grocery stores, food banks, coffee shops, community centers, or drop-in centers, places where they can start to connect with their community and feel at ease. Knowing how to get to these places gives us a sense of belonging and a feeling that we're part of a community. I bet we all know our neighbors. You probably say hello to people you see on a daily basis in your neighborhood. I'm sure you'll agree it's a good feeling when someone says hi and addresses you by name when you're in your community. So community asset mapping. It's the process of identifying and mapping the assets of a community. Assets are the things that are important to the members of the community, such as people, things, services, resources, and connections that the community wants to keep, sustain, and build upon. People who go from being unsheltered to being housed have lost on this type of community, some for years or even decades, as it's a missing piece that needs to be addressed when they move into permanent homes. They are no longer surrounded by friends from the shelters in the downtown core, and they are often far away from known services. Well, it's wonderful when we are able to find permanent housing for an individual who has been living in shelter. What we find in most cases is that once they are moved in and the excitement of having their own home has worn off, we hear that they feel lonely or bored. They have gone from being surrounded by people in shelter, full-time staff, and people coming and going, so the silence in their new surroundings can be difficult to manage, often leading to challenges such as increase in mental health symptoms, home takeovers, or substance use as a means of coping with their loneliness. It shouldn't be a surprise that clients invite strangers into their homes to help curb their loneliness, when prior to being housed, they came from a shelter environment where they were surrounded by people constantly. Humans are social creatures after all and need human connections. We knew we needed to find a way for clients to feel connected to their neighborhoods right from the moment they moved in. This was when we started implementing community asset mapping on the Housing First team to help support clients during their move-in. At Options Housing, we do yearly surveys with clients in all levels of programming. These surveys took a look at the level of client satisfaction and posed questions around where they feel they could use more supports. I will preface the results by saying we come highly rated. But most notably, in the last several years, there has been a consistent theme where clients indicated they would like more opportunities for socialization and social programming. As part of our plan to address these needs, we have been offering community asset mapping to all clients who are newly housed in hopes that they can feel more connected to their community upon move-in and to help increase their chances of stable and permanent housing. And with that, I will pass it along to my colleague.
And there we go. Good afternoon, everybody. My name is Stephen Sauppe. I'm a peer support worker with Options Housing here in Ottawa. I'm also a person with lived experience. when I first started with options at Housing First, back in 2023, my manager came to me and asked me to start working on the community asset mapping program that she wanted to implement. I was not really sure what she was talking about. I had never heard the term community asset mapping before, but quickly came to realize that it was really just a means of trying to support our clients with finding the everyday things that we all kind of take for granted. Things like grocery stores, coffee shops, banks, pharmacies, the things that they've gotten used to in the locations where they were previously, and now would probably need to know where they are in their new surroundings. So as it was explained to me, and as we started to do, I would reach out to a client shortly after they moved into their new surroundings and ask them if they needed any help finding things in their community. Again, mentioning that it was anything that they wanted, the basics, whether they wanted to find a bookstore, they needed help with bus routes, anything of that nature. Whoop, no, wrong one. That's all right. You know, we're just being interactive. It's okay. It's all good. It's okay. Sure. Awesome. Ashley was the one who did the PowerPoint, so she's the master of the PowerPoint. So it was basically just a chance to give our clients the understanding and the ability to understand they were going to be supported, that we weren't just saying, oh, hey, you got a new place, good luck. Right, and wait for them to call us all in a panic about, oh, I don't have any food. Where am I going to go? I don't know what to do. So that's the goal of the community asset mapping program for us, is to once again just to show our clients that you're not alone in this. As somebody with lived experience, I can tell you that sometimes pride gets involved. We don't want to admit that we're lost. We don't want to admit that we don't know where something is. Oh, I can just do it myself. But as Ashley pointed out, some of our clients, they don't have access to internet. They don't have access to a phone, to a smartphone where they can call up Google Maps and, hey, Uber, where's or hey, Siri, where's this? So we really want to try and support them in that sense. Some of the things that we tried to incorporate in the asset mapping was, one, try to make it as within a reasonable distance from where they are, typically 3-4 block radius, so within walking distance. As again, some of our clients don't get the financial assistance to have a bus pass or get bus tickets to take public transit. We also wanted to make sure, like I said, that they get. It's not just we're telling them where to go. We want them to have agency in this program that we're doing. So that's another big thing that we wanted to do. Now I can go to the next slide. There we go. So some of the challenges that I've found working with this, one, and this is going to be probably counterintuitive, but a lot of clients really didn't reach out to us. Like I said, I think it's a mixture of pride, not wanting to admit that I need the help. Sometimes I think I've heard from some of my clients that they feel like they've got too much structure now in their lives. They've got a housing-based case manager that's helping them with finding a house and making sure I can pay my rent, and I need help getting my ID, all those types of things. And then here comes Steve, the peer support worker, with, hey, I'm here to help you now find places to go and things to do. Some people just don't like that. They don't, or they want it, but they don't want to admit that they want it. So it's really trying to build that relationship and to let them know that you have agency. Well, I'm here to do what you need to, what you identify, what you want, not me just coming in telling you, hey, you should know where this grocery store is, or hey, you should know, where the closest Timmy's is because I want you to buy me a coffee, right? That's not what we're here for. We're here to make sure that they have agency and that they identify to us what they want. The other thing too is I think sometimes people, they don't really know what they want. They just know they want something. As Ashley mentioned earlier, you know, a lot of times they're lonely. They want that social interaction. They want that social inclusion, but they don't know what that looks like. Especially, I think, if they've been coming out of a shelter system where they might be dealing with addictions or with mental health problems, and they're trying to get away from what they knew as normal. So if I'm trying to get away from all that, I don't know what else there is. So again, just trying to build those relationships and say, hey, you know, what can we look at? What do you want? You know, because they are human beings. They have agency. They have thoughts and feelings, and we need to all respect that. And then finally, because we've noticed that there's been such a lack of uptake in what we're looking to do, I've talked with my colleagues, and we've kind of decided that maybe we'll try a different approach with this community asset mapping, which is more of trying to find common areas where we've housed the bulk of our clients, because we know we have certain landlords that we like and that will take our clients. So we know there's certain areas of the city where we tend to put them, and just making a kind of a generic map. So knowing that, well, what's important to our clients that we hear about all the time. We know they're looking like, where's the closest grocery store? Where's my closest bank? Where's the closest food bank? You know, where's our closest pharmacy? I need to change I need to transfer my medications from downtown to the West End. So things of that nature that we can then just have ready on hand. And when our HBCMs house another client in that area, they can just go into their folder and pull out a map and give it to them upon when they move in. So that there's not that added stress of, oh no, I'm moving in, I don't know what's going on, and now I have to meet somebody else. Now I got to tell my story again. Now I gotta, you know, play nice with one more person that I don't know. So we think that will definitely help. There will be my contact information, and whoever else will come onto the project later will have their information at the bottom of that map, so that they do know that if you want more information, if you need something a bit more personalized, reach out to us. We're here to help, but not kind of adding to that stress of having just moved to a new place and then having somebody coming in and bombarding you with questions. So that's kind of what we're doing right now with community asset mapping. So I want to thank you all for letting me speak, and I hope you all have a good rest of the day. Thank you. All right, sounds good. Thank you.
Thank you so much, Ashley and Stephen. What an innovation, and tapping into what is, you know, such a clear need when people make that transition. Terrific. I'd like to invite the other presenters back to the stage. We have like 20 minutes for Q&A, if I'm doing timekeeping correctly, which may or may not be correct. Please get cozy up here. There's not enough chairs. A couple people can be over here.
It's a great Canadian standoff. I like that one.
Does anyone have any questions for the presenters? Yes.
Hi, my name's Carmen. I'm with the City of Surrey in BC. And this question is for the first two presenters, Madison and Raynor, I think. Mm-hmm. So for the rent subsidy you were talking about, did the money come from the municipality, or did it come, okay, so being another municipality and understanding that that's taxpayers' money, what was the pushback from the community? Or was there?
I don't know if you can you just hear me if I just talk loudly? Honestly, pushback from the community, there was none. We heard nothing from the community. In fact, if we heard anything, it was, why did you stop?
And so, first of all, that's fascinating to me. So those rent subs were time limited?
No.
There's ongoing,
Yes.
still funded through the municipality?
Yes, they are ongoing. They do, like all of our other rent supplements that are done at different levels of the government, there's annual check-ins and it's based on your income and stuff. We have already had one person who is no longer receiving it because they got a job that was able to cover their rent. So there is a downward slope. There are no more rents, this enhanced benefit being provided, but those that do have them, there's no time limit.
Amazing, well done.
Over here, yeah.
My question's for Raynor as well. So with what I've worked for Norfolk County, the municipality, and we have similar rent sub agreements. What do those agreements look like if they can just drop off and they're not time limited? Like, I'm just wondering from like a municipal perspective, like the agreements that you're holding with the landlords, like if they're not time limited, they're just.
I will be honest, I do not know the exact wording, as we had rent supplement agents who did the agreements. They did mirror the ones that they had for other rent supplements, and that I'm happy to take your contacts and find out more information for you, but I don't know if there was some added nuances in it.
First of all, I've talked for the first two presentations, but I just want to mention that the community asset planning is just such a smart idea, and I really appreciate the work that you guys are doing.
Thank you very much.
I'm just wondering, with both programs were framed as portable housing benefits, can folks leave Ottawa and still have a benefit?
Go first.
I know it's two different programs, but yeah.
Ours, it's Ottawa.
Yeah, this one's Ottawa as well. The idea is that it's linked to the private market rents, so that's what makes it portable instead of the subsidies linked to the housing units, yeah.
I think, again, for the first two, presenters, I think the enhanced benefits are paid to the landlord, but the OMRA one is paid to the household.
Yeah.
Yes. The other question that I had, clarification about the OMRA one, was maybe just how do they calculate them? You give an average amount, but how are they calculating, and what is that looking like?
Yeah, so they look at all of their sources of income, whether it's supports or part-time work. They calculate, often it's just looking at 30% of that income going towards rent, and then they'll look at the rent for the unit that they're in, and they'll calculate the difference.
Okay, so it's based on actual rent, actual income.
Yeah, that's why it's very individualized. Yeah.
Thank you.
I was just wondering, for the first presentation, you mentioned that you were able to recruit a lot more landlords that were interested in the project, and I'm wondering if you have any tips or tricks besides just offering a larger rent subsidy that were things that helped you to engage landlords.
Yeah, so the housing team, they did stuff that a lot of housing teams do. They kind of, pound the pavements. They would go, rather than only relying on online listings, they would walk around neighborhoods, try to find for rent signs. And then they also used, because this was a city program, they kind of used the reputation of the city to bring on some more landlords. I think some landlords might feel safer. If it's a city service, it might feel, more secure. I'm not quite sure, but I think that also helped. And then, of course, once they were able to establish a relationship with one landlord, and that, first housing opportunity went well, then they started, getting more and more units from, I think there was, a couple times where there was one trial client going in, but then after that, if the landlord was pleased with how everything went, you kind of get like a bulk amount of units. But I think we can't lie to ourselves. The enhanced benefit does really help.
And just to add on to what Madison said, our housing team were phenomenal. The conversations that they had, the relationships they built, they at some point had landlords who would talk to other landlords who would then call our housing staff and says, I heard you're doing this. And it's through those relationships that we got the number that we did, and why we've maintained the number. And that's the key, is we don't have the enhanced benefit anymore, but the landlords are still offering us units.
Can I have the list of landmarks?
I don't have it myself.
Yes.
Two different questions for two different groups. So for the first group, I'm just curious. First, let me preface. Great work. My brain is going though that you had the opportunity to work with a low acuity client who would be easier to house and retain that relationship with the landlord. I'm just wondering if you've thought of ideas within that of how you extend that to those who are not low acuity in amongst the housing crisis that we're having. Like if you've thought of how to develop that more so?
I can say we didn't necessarily have to go there for the purpose of the project because all of the folks in the PDCs that we were working with were generally, we can't paint it with one brushstroke, but we're generally low acuity. And because it was a rapid rehousing project, I think if it was a housing first team, then we would have had to look at, okay, how do we modify this to accommodate higher acuity clients? But since it was rapid rehousing, it kind of works best with people who have low support needs because you're kind of just trying to do things as quickly as possible. So kind of not really, I don't think that we necessarily explored that. That being said, just because if someone was moderate or high acuity, it didn't necessarily mean that they couldn't access the subsidy. And then that just meant that, caseworkers had to modify maybe their caseload to accommodate, a few people who maybe needed those extra supports.
So to that, did you get any pushback from others in the community that felt like they were being left out?
There was, so as Raynor had spoken about in the unintended consequences, we, received feedback from other housing teams where, they are working with a clientele that maybe is harder to house. And so a mixture of that and not having access to the subsidy made their lives more difficult when they're trying to house their clients. I don't think it was necessarily represented in the housing rates. I think, their housing rates were consistent, but maybe they had to work twice as hard to get those consistent numbers. And then we do know, that since the subsidies were linked to a specific location, I don't know that there was, I don't know actual people in shelter and hearing their feedback, but as Raynor mentioned, there was this kind of like push, okay, well, I need to get in there then if I want to get housed.
And then, sorry, my second question is to the asset mapping. When you guys made the map, was it color coded? Was it in English? Like I'm thinking you might be dealing with a clientele that doesn't maybe speak English or even know how to read. Like how did you guys navigate those pieces?
So basically, I would write it out in Word. I did not color code it, but I would put it in its own little section. So grocery stores, list them. Next section, banks, list them, phone numbers. I had one client who all they really needed was support in figuring out their bus routes to get to their medical appointments. So I just went on the OC Transpo app and found what buses were in his area, and that would take him there, and gave him a general list of here's the bus stop to go to, take it to this bus stop, get on this bus. I haven't heard of anything yet of people that are not able to read, though I am conscious of that. And I have not run into any language barriers as of yet, but I don't anticipate us having a problem accommodating them if that's the case.
I think it's a really, you need to know where you're going to be able to get there. So I think it's a great initiative.
Absolutely. Thank you very much.
Over here and then over there.
I think for the first speakers, I'm just curious about flow. Because you have a number of different teams working on supplements and emergency assistance, other forms of financial stability. And I'm curious about how many times and how your teams are talking to the client versus to the agency and how you kind of streamline that flow of customer experience.
I'm sorry, can you repeat the last portion of your question?
The question is, how did you make that experience flow seamlessly for the client with all these different teams navigating rent?
because they were all kind of there on site, and there was, if you go down a hallway, there was one room where there were some people, and then you go to the next room and there's a different group of people. It actually made it extremely easy, and you didn't have to worry about the flow too much, because it was, oh hey, they're right down the hall, go ahead, and then they can pass them over to the next room, so people can actually just walk around in the building and go talk to whoever. So it was very accessible. It was very easy. There wasn't really a lot of worry about the process of how to get someone from one place to another.
Over you and then over to Jill.
Well, thank you for all the presentations. All three presentations were amazing. And it made me thinking, this is a suggestion, I don't know if there are any CAH organizers here, but it would be great if there's, at the end of the conference, like we have access to the slides, to have some sort of a folder for all the toolkits and all those little ideas in one place where we can upscale them. My question is to Maryann and Stephanie, because my background is in refugee research, so thank you so much for this. You mentioned that there's a disconnect between housing and housing research or research on housing and resettlement. I wonder if you can talk more about what sort of gaps are there. What would you recommend we start with?
Sure. So we did a literature review, and then we also, our expertise is more in the housing literature than the settlement literature. So it would actually be good to connect. But we just in our reviews, there wasn't a literature base on housing first for refugee households, rapid rehousing for refugee households, or really housing in general for refugee households, except for some technical reports on specific communities and programs. So there was a very small literature base, but those technical reports were more framed around settlement and not linked to the housing and homelessness literature. Yeah. But I'd be happy to talk more.
Jill.
Just a note, all of the slides for both presentations, if you go to the bottom of the session, you can download all of the slides.
The resources, the info sheets, how to create a community asset map. I think there's some people interested in that.
I just had a question for the first group. So I just want to say first, all the presentations, it was so uplifting. So thank you. So great to see your work. I had a question for the first group, as you were sort of getting people ready more quickly for housing and the wraparound supports, if physical health and access to primary care was a need, and if how you address that or were unable to.
So unfortunately, that wasn't something that was available on site. That being said, I think that the housing workers kind of did like caseworkers do. They just do external referrals to known community resources. But yeah, because the physical distancing centers had started as a physical distancing center, those weren't built in from the beginning. It kind of just turned into what it was. It wasn't planned from the beginning that would be mostly newcomers. So we were kind of coming in at the tail end of trying to plug in those services that would be helpful.
I asked because I oversee shelter beds, like medical beds in a shelter, and part of when we're getting people ready for housing, if they're quite ill, there's like a need that they want to appear more well. Like, it's kind of sad actually, but trying to get them ready more physically so that they're ready to meet the landlord and obtain housing. So.
I have a quick question for the community asset mapping group. Sorry if I missed this on the slide, but what is the actual format that you're sharing the map? Is it actually like a Google Maps snapshot with pins, or is it just a list? Is it a printout? Like,
it's a printout that I just make a Word document.
Yeah.
And then, I'm going on the net, I'm finding where they are. So I'll use Google Maps based on their address. And then I'll find everything that is relevant, and I'll put it down on a Word document.
Yeah, just a simple list.
Simple list.
And different lists for every person.
That's how it started off. And then, now I'm looking to do more of a generic,
Just a follow-up on her question. Do you ever sit with the clients and kind of develop the map with them?
So that was the goal. But as I was saying during my presentation, a lot of the clients really didn't want to meet. They, whether they were just too stressed out, whether they felt they had enough people already coming into their lives and asking them questions. So no, I mean, sometimes I would communicate via text or email, but there was no face-to-face, unfortunately.
And I think keeping in mind as well that this community asset mapping is meant to kind of happen sort of upon move-in, right? So there's a lot of things happen in a lot of layers, and it can be very stressful. As we all know, moving is always stressful. So when a client's first moving in, that we're throwing in this extra thing is just, it's added stress. So I think, yeah, any way we can manage to get them a community asset map. I think the new way we're going to do it will be really beneficial, because it's more of just giving them a lay of the land, and then they can add on places or social settings that they want to look into.
Yeah. But they are also, I mean, I also always ask the HBCMs to communicate with them that I'm happy to meet with them. I'm happy to, if they want to take a bus ride together, they want somebody to go with them to explore, I'm happy to do that. It just, unfortunately, to this point, that they haven't asked for that.
You've worked them hard. We have time for one more question over here, and then they're all really nice people. Actually, between them and the door, so figure out who you want to talk to. One last question.
Thanks. Me again, back to the whole municipal thing. I know that this was a COVID initiative, and we all, those of us that worked through COVID, we all know it was kind of the wild, wild west, and a lot of protocol was thrown to the wind, which was amazing. But I'm wondering, when it comes back to the funding through the municipality, was it something that mayor and council came to your team with, or did you have to go in and present and say, this is something we've been gathering information on for the last 6 or 8 months, and think that it would be good for the city to write it into their budget?
So I can go on and on about this, and I know we're short on time, so maybe we can chat. But long story short, we went to council.
It was what?
We, as a housing branch, we went to council with basically a housing strategy with short-term, medium-term, long-term goals. So basically going, how are we gonna fix this? And this was one of our short-term, because one of the big things that our council wanted was to get those that were staying at our physical distancing centers with. Those that are not familiar, they're in hockey rinks and community centers. Like, these are not ideal places for anyone to be living. So they want to get them out of there. And this was, at the time, we had 120 people in a hockey rink, and we had like 120 units. How do we mash the two together? And then our numbers went through the roof.
Thank you.
Thank you so much for joining us, and please, if you'll join me in giving all of our presenters a round of applause.